Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Lower abdominal pain potential causes and treatment. The lower abdomen is the area between your belly button and pelvic bone. Lower abdominal pain is commonly caused by trapped gas or indigestion. Less commonly, lower abdominal pain can be a symptom of a more serious issue, like a kidney infection or a twisted bowel. /r/n/r/n Lower abdominal pain is a symptom, not a condition. If you are experiencing it, pay close attention to any other symptoms you may have. For example, if you have lower abdominal pain in addition to another red flag symptom like blood in your stool or vomit, then you need to get medical attention right away. /r/n/r/nVerywell, Jessica OlahrnrnSee, a healthcare provider. If your symptoms aren't going away or are getting worse, or if you have other potentially serious symptoms, such as :r/n/r/n appendicitis is a serious condition that requires emergency attention. When the appendix becomes infected and inflamed, prompt treatment is necessary to prevent the organ from rupturing. /r/n/r/n People between the ages of 10 and 30 are most likely to get appendicitis. It can happen at any age, though. /r/n/r/n Symptoms of appendicitis include /r/n/r/n When the appendix ruptures, it usually alleviates the pain for a while. However, the burst organ spills infection out into your abdomen, where it can spread throughout your body. That leads to sepsis, which is life-threatening. /r/n/r/n Common causes of appendicitis include /r/n/r/n The most common treatment for appendicitis in which the appendix has not burst, uncomplicated appendicitis, is a surgical procedure called laparoscopic appendectomy to remove the appendix. Treatment with a 10-day course of broad-spectrum antibiotics is a potential option for people who have very mild appendicitis without an appendicloth. However, there is a 15% to 40% chance that the appendicitis will recur within 1 year. /r/n/r/n In people with a burst appendix, complicated appendicitis, appendicloth, or people who are severely ill, surgical removal of the appendix, open appendectomy, is required. If the appendix has burst, the surgeon may place a small tube to drain infectious fluids from the belly. The tube will be removed a few days later. The recovery period may also involve a course of antibiotics. /r/n/r/n If you think you have appendicitis or a ruptured appendix, call 911 or go to an emergency room immediately. The condition almost always requires immediate surgery to avoid potentially fatal complications. /r/n/r/n Colitis is a chronic disease characterized by inflammation of the large intestine, colon. It is considered a form of inflammatory bowel disease, IBD. /r/n/r/n Abdominal pain due to colitis may begin suddenly or gradually and become constant or come and go. The pain is often described as a cramping sensation in the lower left side of the abdomen. Most people with colitis experience flare-ups are followed by longer periods of remission, during which time the pain may be milder. /r/n/r/n Other possible symptoms of colitis include /r/n/r/n Possible causes of colitis include /r/n/r/n The exact cause of colitis is unknown in approximately 5% to 15% of cases. However, researchers agree there tends to be a combination of dietary, environmental, and genetic factors at play. /r/n/r/n The first-line treatment for mild to moderate colitis is a class of drugs called aminosalicylates. The use of these drugs can induce and maintain colitis remission by reducing colonic inflammation. Some other treatment options include /r/n/r/n Diverticular disease includes diverticulosis and diverticulitis. People with diverticulosis have bulging pouches that form on the inner wall of the large intestine or colon. When the pouches become irritated or infected, the condition is called diverticulitis. More than half of Americans over age 60 have diverticulitis. /r/n/r/n Some people with diverticulosis have no symptoms at all. However, the bulging can cause abdominal bloating, cramping, and constipation. Symptoms of diverticulitis often start suddenly and can be severe. They may include /r/n/r/n. Although rare, some people with diverticulitis may notice blood in their stool or on toilet paper. If you notice this symptom, it's important to get medical attention right away. /r/n/r/n The exact cause of diverticular disease is unknown, but several risk factors have been identified. In particular, eating a low-fiber diet made up of mostly processed food is thought to be a major contributing factor. A lack of fiber in the diet makes stools harder, resulting in straining. This may increase pressure in the colon or intestines, leading to the development of diverticular bulges. Diverticulitis develops if the bulges become inflamed or infected. /r/n/r/n Once diverticular bulges form, they will not go away, and there is a chance that diverticulitis will recur in the future. You can reduce your risk by introducing more fiber to your diet. /r/n/r/n Treatment for diverticulitis depends on the severity of symptoms and may include /r/n/r/n A kidney infection, pyelonephritis, is a type of urinary tract infection in which one or both kidneys get infected with a bacteria, virus, or rarely a fungus. /r/n/r/n While you're likely to feel some back pain, you may also feel pain under your ribs, around the abdomen, and around your groin. Kidney infection pain is typically very severe. /r/n/r/n Symptoms may include /r/n/r/n If you suspect you have a kidney infection, get immediate medical attention. /r/n/r/n Pyelonephritis is a serious infection that often starts with an infection of the bladder, also called infectious cystitis. When cystitis due to a bacteria, virus, or fungus travels to the kidneys, it can cause a kidney infection. /r/n/r/n Kidney infections caused by bacteria are typically treated with a course of antibiotics, antifungal, or antiviral medication, depending on the type of infection you have. For pain, you may also use a painkiller like paracetamol as needed. /r/n/r/n If you have acute urinary retention, you're suddenly unable to pass urine. Urinary retention can also be chronic. This condition is more common in males, particularly after age 60. The condition begins suddenly. /r/n/r/n Symptoms of acute urinary retention may include /r/n/r/n Sometimes, urinary retention becomes a chronic condition that develops gradually over time. It may begin with urine hesitancy, a slow urine stream, or urine leakage, then progress to a complete inability to urinate. In some cases, people with chronic urinary retention have few or no symptoms, making the condition difficult to detect. /r/n/r/n Urinary retention can occur for a variety of reasons. Most of the time, it is related to a blockage that partially or completely prevents urine from leaving the bladder or urethra. The blockage may be caused by /r/n/r/n Acute urinary retention requires an emergency room visit. At the ER, a healthcare provider will immediately drain the urine from your bladder using a catheter. This will ease your pain and prevent damage to the bladder and kidneys. /r/n/r/n Urinary retention cannot be resolved until the underlying condition is addressed. For example, if it is caused by an enlarged prostate, you may be prescribed a 5-alpha reductase inhibitor like dutasteride or finasteride to shrink the prostate. You may also be prescribed an alpha blocker, such as alfuzosin or prazosin, to ease urination. An antibiotic may be prescribed in case of a bacterial infection. /r/n/r/n Cystitis refers to inflammation of the bladder. It is common, and typically caused by a lower urinary tract infection. Cystitis affects females much more often than males. Menopause increases the risk of developing cystitis due to hormone changes. /r/n/r/n cystitis symptoms include /r/n/r/n. Occasionally, older adults may have cystitis without any of symptoms listed above. In some cases, they may experience fever, confusion, or delirium instead. /r/n/r/n. The most common cause of cystitis is bacterial infection. Bacteria from feces and sexual intercourse may enter the urethra and spread to the bladder, leading to infection. /r/n/r/n. Females are more prone to cystitis. Regardless of gender, having penetrative anal sex increases the risk of cystitis, as it exposes the end of the urethra to fecal matter. Other risk factors that affect males include having an uncircumcised penis and an enlarged prostate. /r/n/r/n. Non-bacterial causes of cystitis include /r/n/r/n. Cystitis caused by infection can usually be treated with a course of antibiotics. For pain and discomfort, your healthcare provider may prescribe a drug called phenazopyridine which targets pain in the urinary tract. A warm sitz bath may also be helpful for pain. /r/n/r/n. Cystitis that is caused by a blockage in the urethra or bladder may need to be treated with a surgical procedure to improve urine flow. /r/n/r/n. Kidney stones are pebble-like masses that form in the kidneys. They develop when there are high levels of certain minerals and acids like calcium, oxalate, phosphorus, and uric acid, which stick together in urine. Most kidney stones are no larger than the size of a pea but rarely can be as large as a golf ball. /r/n/r/n. People with kidney stones may experience sharp pains in the back, side, lower abdomen, or groin. The pain may be constant or come and go. Other possible symptoms of kidney stones include /r/n/r/n. Anytime you notice blood in your urine, be sure to get medical attention right away. This symptom can be a sign of a life-threatening condition, such as kidney or bladder cancer. /r/n/r/n. Kidney stones are common and often run in families. Why exactly they develop is not always clear, although some possible causes and risk factors include /r/n/r/n. Small kidney stones usually pass on their own. Drinking at least 6 to 8 glasses of water per day can help you pass kidney stones. For pain, you can take an over-the-counter pain reliever, such as ibuprofen or naproxen. Other treatment options may include /r/n/r/n. The average person produces anywhere from 1 to 4 pints of gas per day. Most people pass gas 14 to 23 times per day. But sometimes extra gas gets trapped in the digestive tract and causes uncomfortable symptoms. /r/n/r/n. Gas in the digestive tract commonly causes abdominal pain and discomfort. Other symptoms it can cause include /r/n/r/n. The abdominal pain from trapped gas depends on where it is. Left side gas may feel like heart-related pain, while right side gas may feel similar to appendicitis. /r/n/r/n. Gas can end up in the digestive tract when you swallow air or eat certain foods that cause gas. Some foods contain substances that can make you feel gassy, such as /r/n/r/n. Some people are more likely to have gas in the digestive tract, including people who are lactose intolerant or have digestive disorders. /r/n/r/n. While it can be quite uncomfortable, trapped gas is not cause for concern and usually resolves on its own. Allowing yourself to burp and pass gas helps. The following methods can help relieve gas pains, /r/n/r/n. If you have taken steps to reduce gas and bloating but are still experiencing symptoms, call your healthcare provider to rule out food sensitivities or digestive problems. /r/n/r/n. Lower abdominal pain can also be an early sign of twisted bowel. Also known as volvulus, twisted bowel happens when part of your intestine twists around the tissues that hold it in place. The twisting can result in a loss of blood supply, bowel obstruction. /r/n/r/n abdominal pain from a twisted bowel is often described as a cramping sensation that may be constant or come and go. Other symptoms of a twisted bowel include /r/n/r/n. A twisted bowel can become life-threatening if infection, bowel obstruction, or other complications develop. Get immediate medical attention if you develop any of these symptoms. /r/n/r/n. A twisted bowel is caused by differences in the structure of the intestines and surrounding tissues. These differences may be congenital, present at birth, and may include /r/n/r/n also, volvulus affecting the sigmoid colon. Sigmoid volvulus is more prevalent in older adults who live in nursing homes or other long-term care facilities, as these individuals tend to spend long periods of time lying down in bed. /r/n/r/n. A twisted bowel is an emergency condition that requires immediate medical care. This condition is most often treated with emergency surgery. If there are no signs of colon damage, a surgical procedure known as a flexible sigmoidoscopy can be done to untwist the volvulus. /r/n/r/n. If this procedure doesn't work or there are signs of colon damage, surgery to remove the affected part of the colon will likely be done right away. /r/n/r/n. Menstrual cramps happen due to uterine contractions. More than half of menstruating people experience some pain for at least 1 to 2 days each month. /r/n/r/n. Menstrual pain can be mild or severe, and dull or throbbing. It is typically continuous for a few days in a row. You may experience lower back pain in addition to lower abdominal pain. Other symptoms that may accompany menstrual cramps include /r/n/r/n. Mild to moderate pain and cramping are a normal part of menstruation. However, some people experience menstrual cramps due to another disorder or infection. This is called secondary dysmenorrhea. This abnormal cramping can happen for several reasons, including /r/n/r/n. The first-line treatment for menstrual pain is pain-relieving medication. You can take an NSAID, such as aspirin, ibuprofen, or acetaminophen to reduce pain as needed. Other options for reducing menstrual pain include /r/n/r/n. Most people poop between 3 times per day and 3 times per week. At some point or another, however, most people develop constipation, an uncomfortable condition characterized by difficulty having a bowel movement. Constipation is generally defined as having fewer than 3 bowel movements in a week. /r/n/r/n. Symptoms of constipation can vary from person to person and may include /r/n/r/n. Constipation occurs when the colon absorbs too much water, resulting in hard and dry stools that are hard to pass. Some of the most common causes of constipation include /r/n/r/n. Constipation is sometimes due to an underlying condition, such as irritable bowel syndrome or a problem with intestinal function. It can also be caused by some medications, including antidepressants and opioids. /r/n/r/n. Eating more fiber and drinking more clear liquids, like water and tea, is often enough to treat constipation. A few cooked prunes or figs, which are high in fiber, can help. In more severe cases, taking a laxative medication can quickly put a stop to constipation. Another option is to use a magnesium supplement, such as magnesium oxide. /r/n/r/n. Eating 20 to 35 grams of fiber per day is the best way to prevent constipation. Limit foods like ice cream, cheese, meat, and processed foods, which contain little to no fiber, and instead consume more whole grain foods, fruits and vegetables, and legumes. /r/n/r/n. Irritable bowel syndrome is considered a functional bowel disorder, not a disease. About 10% to 15% of people in the United States have symptoms of IBS, which can occur at any age. It is not the same as irritable bowel disease, IBD. /r/n/r/n irritable bowel syndrome causes various gastrointestinal symptoms, including /r/n/r/n symptoms are usually mild but can become severe. The above symptoms are considered IBS if you have them at least 3 days per month for 3 months or more. /r/n/r/n It's not always clear why IBS develops. In some cases, a person may develop IBS after having a bacterial or parasitic infection that affects the intestines, post-infectious IBS. Stress is also a common cause. /r/n/r/n Diet and lifestyle changes such as avoiding triggering foods, eating slowly, eating smaller meals, and adding fiber to your diet are typically the first recommendations for people with IBS. More severe cases of IBS may be treated with the following medications, /r/n/r/n if your abdominal pain doesn't seem to be the result of indigestion and is getting worse or not going away. You should see a healthcare provider. /r/n/r/n They will likely perform a physical exam and ask about your symptoms in detail. They may also request tests to rule out possible causes of your abdominal pain. /r/n/r/n Expect your provider to ask you about the exact location of the pain and to describe the sensation you're feeling. They may perform a gynecological or rectal exam if you have lower abdominal pain. /r/n/r/n Testing may include /r/n/r/n if you could be pregnant. An ultrasound is the preferred imaging method for evaluating unexplained abdominal pain. /r/n/r/n Sometimes people mistake pelvic pain for lower abdominal pain. Conditions that can cause pain in this area include /r/n/r/n Lower abdominal pain can be acute or chronic. It can be a symptom of minor or major digestive system conditions such as gas, indigestion, constipation, colitis, diverticular disease, or appendicitis. /r/n/r/n Gynecologic conditions such as menstrual cramps or pregnancy may also be causes, as can kidney stones and urinary tract infections. /r/n/r/n Treatment depends on the underlying cause. It may include anything from over-the-counter antacids to emergency surgery. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.